Today we're going through a book, Clinical Ophthalmology, Kansky, a Systemic Approach by Brand Bowley, 8 editions. Okay, so we'll go through, it's one. So we've got different chapter here, but today we're going with okay, so we'll go with chapter 16, Retinal Detachment. All right, let's go to that chapter. Okay, so chapter 16, Retinal Detachment. Let me just reduce the size. Okay. All right, so introduction. So we'll start with anatomy of the peripheral retina, pars plana. So the ciliary body start 1 millimeters from the limbus and extends posteriorly for about 6 millimeters. The anterior 2 millimeter consists of pars placata, the remaining 4 millimeters, the flattened pars plana. In order not to endanger either the lens or retina, the optimal locations for a pars plana surgical incision or intravitreal injection is 4 millimeters and 3.5 millimeters posterior to the limbus in phakic and pseudophakic eyes, respectively. An incision through the mid pars plana will usually be located anterior to the vitreous base. See below. Okay, oral serrata. The oral serrata in figure 16.1 is the junction between the retina and the ciliary body. In retinal detachment, fusion of the central retina with the retinal pigment epithelium, the RPE, and the choroid limits forward extension of subretinal fluid, SRF, at the aura. However, there is no equivalent adhesion between the choroid and sclera, and choroidal detachments may progress anteriorly to involve the ciliary body, the ciliaro-choroidal detachment. So dentate processes are tapering extension of retina onto the pars plana. They are more marked nasally than temporally and display marked variation in contour. The oral bays are scalloped edge or pars plana epithelial between dentate processes. Meridiano folds are small radial folds of thickened retinal tissue in the line with dentate processes, most commonly in the superior nasal quadrant. A fold may occasionally exhibit a small retinal hole as its apex. A meridianal complex is a configuration in which a dentate process, usually with associated meridianal fold, is aligned with a ciliary process. Enclosed oral bays are small islands of pars plana surrounded by retina as a result of meeting of two adjacent dentate processes. They should not be mistaken for retinal holes. The vitreous base is 3 to 4 millimeters straddling the oral serrata, throughout which the cortical vitreous is strongly attached. Following posterior vitreous detachment, the posterior hyaloid face remains attached at the vitreous base. Pre-existing retinal holes within the attached vitreous base do not lead to retinal detachment. Blunt trauma may cause evolution of the vitreous base, with tearing of the non-pigmented epithelium of the pars plana along the base anterior border and of the retina along the base posterior border. Innocuous peripheral retinal degenerations. Peripheral retinal degenerations and other lesions carrying the potential to lead to retinal detachment are described separately. So you've got microcystoid or peripheral cystoid degeneration. Consists of tiny vesicle with indistinct boundaries on a grayish-white background, making the retina appear thickened and less transparent. The degeneration starts adjacent to the oral serrata and extends circumferentially. We'll look at the picture. So this is the oral serrata and normal anatomical landmark. So you got the short ciliary artery at the top, temporal oral serrata at the edge here, short ciliary nerve, got the macula here, long ciliary nerves, you got microcystoid degenerations on the edge, short ciliary nerves here, a vortex vein, long ciliary nerve again, vortex ampulla, nasal oral serrata. Okay. Okay, so posteriorly with a smooth undulating posterior border. Microcystoid degeneration is present in essentially all adult eyes, increasing in extent with age. Alright. It is with age. It is not in itself casually related to retinal detachment, though it may give rise to typical degenerative retinal crisis. Here you got paving stone degeneration. It's characterized by discrete yellow-white patch of focal chorioretinal atrophy that may have pigmented margin. Figure 16.4b. So B is here. Enclosed oral serrata bay here. Alright, it is typically found between the equator and the aura and is more common in the inferior fundus. It is present to some extent in at least 25% of normal eyes. Reticular or honeycomb degeneration is an age-related change consisting of a fine network of perivascular pigmentation that sometimes extends posterior to the equator. The peripheral drusen, clustered or scattered small pale discrete lesions. It's in 16.4e. So it's not, it must be in another page. That may have hyperpigmented border, figure 16.4f. They are similar to drusen at the posterior pole and usually occur in the eyes of older individuals. Pars plana cyst, a clear wall cyst, figure 16.4g, usually small, derived from non-pigmented ciliary epithelium. They are present in 5 to 10% of eyes and are more common temporally. They do not predispose to retinal detachment, RD.